Hey, everybody. I'm super excited to introduce you to my new guest. And this is Dr. Caleb Walls, and he is amazing. I had the opportunity to meet with him a couple of weeks ago for a one-to-one. And let me tell you what, this young man has it going on. He has so many amazing goals, and he is so excited about helping more people in our community through physical therapy. So I wanted to take this opportunity to have you all meet him and learn a little bit about him, as well as how he can help you heal better, feel better, and live better. So Caleb, thanks so much for joining me today.
Yes, I'm excited to be here. I appreciate the invitation, and I'm excited to share a little bit more about the physical therapy field and maybe some things that are changing in the physical therapy field, and maybe we can help some people out there in the valley.
Yeah, absolutely. So start off just by telling us a little bit about you.
Yeah, so originally born and raised in Ohio. My folks are still in Ohio. I attended Morehead State University, which is in Eastern Kentucky, for my undergraduate studies. I played football there and studied exercise kinesiology. From there, I attended Ohio University's DPT program or Doctorate of Physical Therapy program. So I was in Athens, Ohio for about three and a half years doing my DPT studies. After that, I decided to subspecialize in sports and orthopedics. So I spent a year and a half in a sports residency in South Carolina with a group, Pro Access Physical Therapy, and they had a joint venture with Steadman Hawkins Orthopedic Group. So that was an experience that really changed kind of the way I practiced and my understanding of sports and the rehabilitation side of sports and orthopedics. After that, I moved to Arizona. I sat for my board specialization. Being a board certified specialist in physical therapy is not as well known or as common as what we see in the traditional medical field.
Mhm.
For example, in Arizona, we have about 3,500 physical therapists. Most
Wow.
of those are in Phoenix. And out of those 3,500 clinicians, we have 58 board certified sports specialists. So
Wow.
it's something that I'm proud of. I think it brings a unique angle to physical therapy. Once I got here to Arizona, I had an opportunity to take a clinic director position. And so I managed clinicians as well as treating patients there at that traditional orthopedic clinic for 5 years. And then decided it was time to kind of make a move and venture out on my own. My wife, I'm married. I met my wife in physical therapy school in Ohio. She's also a physical therapist, and she stays on the neurological side of things. And we have a year and a half old boy, and we recently found out we're expecting number two. So we're excited. Thank you.
Congratulations.
Thanks. We're excited about that. Obviously, that's some exciting news in our lives, and so we'll be expecting our second baby in December.
Wow. So you are very busy.
Yeah, to say the least, for sure.
That's awesome. So, after I had the opportunity to meet with you, I learned that you have a very unique type of practice. So, what made you choose to pursue your own physical therapy practice and more specifically, your mobile practice?
Yeah, so it's a great question, and I'm going to answer it sort of with a question. um, have you ever gone to a traditional physical therapy clinic and maybe you sat in the waiting room for 20 or 30 minutes filling out paperwork, right? And then you
Mhm.
sat for another 10 minutes waiting for your therapist to come and get you. And that anxious nervousness of sitting in a waiting room of a doctor's office, right? I experience that when I go to the doctor.
Mhm.
And then you go in and you see the physical therapist for 5 minutes and they put you on a generic warm up bike or something like that. And then a tech or a trainer take you through the rest of your exercises. Unfortunately, that is what I was exposed to here in Phoenix when I moved here. And to be honest, I sort of lost the passion of treating my patients when I was in that system.
Mhm.
It didn't allow me to serve the patients the way that I felt I could.
Mhm.
And so the model that I developed for this practice allows us, the therapist, to perform an unbiased evaluation and construct a plan of care without insurance or productivity restrictions or limitations. So it allows the therapist to put the patient first every single time.
Mhm.
And that's why I'm passionate about what we have to offer. And it's why I think we're offering something that's totally unique and different in the Valley.
Absolutely. Okay, folks, listen to this. This is so important to understand. Your insurance company is not going to make you better. They don't care. Okay, you guys.
Not the priority
That
for
is
them.
that is also why we function outside of the insurance industry, because there are so many limitations that really prevent you to truly getting better. And that's what we're focused on. And that's one thing that I really appreciated about Caleb is he is the same train of thought that we are, that we want to truly help our patients. And we are not going to let an insurance company, someone who has a bachelor's degree, tell us the best way to treat our patients and to help them get better.
Exactly right. Exactly.
Awesome. And because we do what we do, like Caleb does, we're able to help people really optimize their healing and their health. And that's what we're all about, just like he is as well.
Yeah, it takes the handcuffs off, right? Of us, the clinician, allows us to do the things that we've been trained in, and it allows patients to get back to whatever their goals are, right? If they want to run a marathon, great, let me help you do that. If you just want to walk across the room to the kitchen and be able to cook a meal, that's fine too, right? Let me help you do that without any restrictions, and the model we've set up allows us to do that. So
That is awesome. So tell me what makes wall to wall sports and rehab different?
yeah, I mean, I think a lot of what we just touched on, right? I
Mhm.
think the majority of my patients that I see, I go to them. We're mobile, and that takes the burden off of the client or the patient, right? We all are busy. We have busy schedules. So we bring the necessary equipment to their home. We spend an hour or longer with them. They're always treated by a doctor of physical therapy. They will never be seen or even communicate with a tech or a trainer or anything like that.
Nice.
And they have access to me throughout the course of their care. And so the term concierge, we take that to heart, and we try to deliver that, and we remove the burden off of our patients by making things as convenient as possible and providing a thorough assessment and plan of care.
Mhm. I love so much that you really look at each individual person and develop a treatment plan just for them. Like you said, you're not a cookie cutter kind of place. And, I'll be honest, I've had to have physical therapy 3 different times. And unfortunately, it was not a good experience because it was very much that cookie cutter. My tech said, do this exercise. I'll check on you in 5 minutes. And then he'd take me to the next one, do this exercise. I'll check on you in 5 minutes. And literally, it was like $300 each
Yeah.
time I went, and I barely saw a person for a minute.
Yeah, and so you bring up a couple great points, right? Number one, I don't think the techs, the trainers, or the therapists are unable to deliver high quality care. They're put in a system that doesn't allow them to, right?
Yes.
And that's unfortunate, because there's a lot of great clinicians out there that can provide some really great care
Mhm.
if they would get out of that, I'm going to say, broken model.
Yes.
The other point is that I wanted to make, if you just think about setting up an appointment at a physical therapy office or another physician's office, right? You're gonna go see your primary care physician, pay a copay, which copays are increasing every year, and maybe go through some unnecessary imaging or whatever it may be, then get a prescription, then set up an appointment at the physical therapy office around your schedule. Maybe you have to find childcare to allow you to come to the office, or you have to bring your kids with you. And then you're going to go through the process of sitting in the waiting room, filling out paperwork, jumping through all of these hoops. And, it just should be more efficient and effective than that.
Yeah, your model really removes so many barriers for people.
Absolutely.
So yeah, so convenient. And we are in the day and age of, convenience for sure. So the
Yeah.
fact that you're able to provide that it's a win-win situation for everybody.
Yes, absolutely.
So what age ranges and diagnosis do you usually treat?
Yeah. So, I would say this. So I will treat individuals as young as 5 years old, as long as it's an orthopedic pathology. I don't try to say that the neurological side of things is my specialty. If I'm doing an evaluation on somebody and I feel it is outside of my area of expertise, luckily the physical therapy world and the healthcare world is not that large, right? And I can get them to somebody who can help them better than I can. So we try to be very open and honest about whether or not they're a good candidate for us after our initial assessment, and helping them get in front of the right people if we are not. But for the large number of patients, we're able to help them, and I would say from 5 years all the way through the lifespan. Specializing in the orthopedic care. So we see a lot of total joints. I've been trained in immediate post-operative care. So during residency, we would see individuals post-op day one. And so we would do all the wound care, suture removal, those sorts of things post-operative. And then we would take them all the way back to whatever activity or whatever goal they have. As far as individual diagnoses, I enjoy complex diagnoses that make me think a little bit. Not that, almost all diagnoses make you think, but some of those more complex cases, multiligamentous knee injuries or multi-directional instability of the shoulder in your overhead athletes, those are the kind of things that I'm really excited about and I see a lot of. And the residency trainings allowed us to become a leader in the treatment of youth, specifically spine injuries in gymnasts and dance populations as well. We see a ton of instability injuries in the spine of our dancers and our gymnastic individuals. And we've even sat through specialization training for our golfers. So we're TPI certified, or Titleist Performance Institute. So those individuals who are passionate about playing the game of golf, we can help as well.
We have a lot of those around here, don't we?
We do. That
we
may or may not be one of the reasons I moved to Arizona.
we see a lot of golfers too. In fact, we were just joking around earlier, a lot of times it's only golfing season that we see them, because that's what their golf game is suffering because they're out of alignment. So then they're like, all right, I gotta go get lined up so I can have a good golf game.
Well, and a lot of people are retiring here just to play golf year round. I mean, it's talk about a goal, right? I mean, you got to get them back to playing golf. That's what they want to do.
Yeah, absolutely. So as a new patient, what would I expect on my first visit?
Yeah. So let's just kind of walk through that. So, if you would call us to set up an initial assessment, or even just to ask more questions, you can expect to talk to me. Maybe not initially, but you will get a call back from me. And then, we'll talk through the basics of what's going on to see if it's a general fit for physical therapy evaluation. And then we'll talk about where they want to do that evaluation. So, just because I'm mobile does not mean I have to come to someone's home. I've gone to their office or their gym or whatever space they feel comfortable and is most convenient for them.
Mhm.
We will bring all of the equipment with us, our treatment table and all of our assessing tools. Sometimes it's multiple trips to the car to get the equipment in, but that's okay. And then we have you fill out basic paperwork online prior to that session. You'll have access to that online, and it takes less than 5 minutes. Honestly, I've done it myself multiple times to make sure it's under 5 minutes.
Nice.
And that way, at that initial assessment, we can focus on the patient's story, right? We take a lot of time to sit and listen,
Mhm.
and we don't have to go through every single step of past medical history because we've already reviewed that prior to showing up at their home. At that point, we'll do our assessment, our exam, which will include passive and active range of motion, manual muscle testing, stability assessments, and then some special testing of the joints for specific diagnoses. We will come to a conclusion at the end of that assessment to provide a physical therapy diagnosis. That is a little bit different than a medical diagnosis, but we will provide the patient with a physical therapy diagnosis, and then we will discuss what our what our plan would be for that patient moving forward, whether that be physical therapy or if we see any potential red flags during that assessment, then we would talk about that and refer them out to the correct healthcare provider. Um, they would be provided with a comprehensive home exercise program after that initial assessment. And then we would talk about scheduling out and whether it be once a week, once a month, or 3 times a week. It's extremely individualized based on the pathology, the impairments, and what that patient's goals are.
Nice. So one of the most popular things I hear about right now with physical therapy is dry needling. So we even have
Yes,
some patients and clients of ours that get dry needling done. So is this a service that you do?
we do. So we do a fair bit of dry needling. I would say this. So dry needling is a nice tool that we have in our tool belt, and there is a time and a place for it. We probably perform it maybe once a day, once every other day, something like that. But it is not something that we perform on every single individual person.
Mhm.
We like to do our initial assessment and come up with a working diagnosis prior to saying, "Hey, let's do dry needling," right? We need to make sure that it's the correct diagnosis and it's the correct patient for that treatment. Um, Dry needling, just to talk about what it is, it's basically the introduction of a fine, like filiform needle into the tissue. And what that means is it's dry because we're not injecting any medication or anything like that through the needle into the body. So it's just the mechanical manipulation of the needle in the tissue that we're aiming, and this creates a healing response in that tissue. The tissues that we can treat are, as general as muscle, fascia, tendon. You can dry needle the joint capsule, ligaments, or even the perineural tissue. So we're not gonna needle into a nerve, right? That's a no-no. But we do actually have certain points of our body where we're gonna aim to get those needles and surround these superficial nerves. And we can downregulate or upregulate the nervous system, which is key in controlling tight muscles or weak muscles and pain, right?
Mhm.
Something that's really neat about dry needling, and I think it's why people call all the time, "Can you do dry needling? Can you do dry needling?" is because when needles are used, especially when they're placed close to the site of pain, we tap into all 3 levels of pain control. What I mean by that is there are local chemical receptors that we can manipulate. Then there's segmental and then systemic pain control. So when we're needling around those perineural tissues, we can affect pain control from basically the central nervous system throughout your body. You'll
Mhm.
see a lot of people talk about, let's say they have left elbow pain and they just had surgery, so we don't want to stick needles in that. There are other areas of your body that you can put those needles and affect pain management in that left elbow, right? Which is
Mhm.
a little bit hard to wrap our brains around. I respect that and understand that. But there's a lot of research that supports that, and a lot of anecdotal evidence as well.
Mhm. Well, I know we have patients or clients of ours that have really found it very helpful for many different issues. So that's great that you offer
Absolutely.
that service.
Yes, absolutely. And if it is something where, let's say we've gone through an entire plan of care and it's an active adult and they go out and push themselves really hard and they just need a recovery session, we do offer, versus an entire PT session, we offer recovery sessions where we will do dry needling, soft tissue work, cupping, those interventions, just for the recovery to get that patient ready for their next workout.
That is good to know as well. That's awesome. So you talked earlier about that you set people up with some home exercises. And, some people have a gym, some people have a home. So for people that don't have a gym or gym equipment, how are they able to do those exercises at home to really get better?
Yeah, so it's very rare that you need some of the big, bulky, heavy duty equipment. There is a time and a place for that, don't get me wrong. And for those patients, we have that conversation early on to say, hey, this may be something where you're going to need some of this higher level equipment, especially when we get to phase 3 and phase 4 of rehab and we're getting back into those higher level activities. and we will work with them to integrate them into a gym setting, right? So we will go to these gyms with the patient and teach them their programs in the gym. We have a lot of good working relationships with a lot of the big gyms here in the Valley, as well as some of the small local gyms. The other thing that we will do, we do have our own gym space where patients can come and do some of their sessions at our facility. Obviously, that eliminates some of the convenience factor, which I spoke on earlier. So that is rare, but those patients who are progressing back to, let's say, your marathoners or avid runners, or your football players, something like that, who need heavier equipment that we can't carry in our car, we have options for them as well.
That is awesome. So, are you able to communicate or work with people's medical doctors or orthopedic doctors?
Yeah, so something I'm passionate about is working as an interdisciplinary team, right? You and I sitting here having this conversation is a really good start, right?
Mhm.
Sometimes people think physical therapy and chiropractic, right? They just, oh, they don't see eye to eye and they're not going to work together. I think that's absurd.
Absolutely. They work beautifully
They
together.
and if they don't, they should, right?
Yes, absolutely.
um, that goes across the board in healthcare, right? There are things that I am not educated on that you are, and that or a physician is, or whoever it may be. And so, if somebody has struggled with getting better, improving their impairments, and they only worked with a physical therapist, it might not be that physical therapy is wrong for them. It just, you need more help, right? You need more hands working with that patient, and I advocate for that, right? And so if I see somebody with some, a complex disorder or diagnosis, I'm going to call their primary care physician. I'm going to start there, and then I'm going to work to whatever specialists that need to be involved as well, and advocate for that patient, right? Because the patient doesn't always know who to reach out to or what to say.
Mhm.
And sometimes it helps to pick up the phone and, me saying, hey, I'm a physical therapist on behalf of this patient, that opens some doors and some line of communication with that healthcare provider. So anytime there's a need for us to reach out to the patient's physician, we will do that and create a working relationship with them.
That is wonderful. I think
Absolutely.
too, as a patient, sometimes that whole system can be just so overwhelming, and you don't feel like you have access to be able to communicate things to your doctor a lot of times. So
Yeah,
having you as kind of that in between and being able to advocate and work together is awesome.
absolutely. It's
Yeah.
it's necessary, and I think it's something that we can do better in this country. Honestly, we can get better at working interdisciplinary and advocating for our clients.
Yes, absolutely. So here's a fun question for you. So, what is your favorite diagnosis to treat?
Um, that's hard. Yeah, I don't even know where to start with that, but I would say this. I'm passionate about golf. That is one of the reasons I moved to Arizona. Don't tell my wife. Um, I enjoy treating that population.
Mhm.
Now, there's a number of injuries that can come with that, right? We usually think of low back pain, but there's a lot of other diagnoses that can affect your golf swing.
Mhm.
But I do enjoy working with that population, whatever diagnosis that is. If we start to talk about specific diagnoses, I have a special place in my heart for ACL reconstructions. I know a lot of physical therapists do, but really the complex multi-ligamentous knee injuries. So, ACL and PCL together with let's call it a meniscus tear and a tibial plateau fracture, right? That's a really complicated
Mhm.
knee injury, and it really makes you think and use your head, especially the first 6 to 8 weeks out of surgery. And so for me, being sort of the nerd that I am, I geek out about that a little bit and really enjoy that. Um, this is a terrible answer because I'm naming a lot of different diagnoses, but I also enjoy my overhead athletes, so my baseball and volleyball individuals, and a lot of times what we see is some sort of instability in those shoulders, and so that is kind of the wheelhouse for a physical therapist to create some stability in that joint and try to fight. You don't want to go in and have a labral surgical repair or, some of the more complex stability surgical repairs on your shoulder that you're using day in and day out for your sports. So those are fun cases as well.
Nice. You and I are very much in the same thought of, there is a time and a place for drugs and surgery, but let's
Yeah.
have that be stop Z
Yeah.
rather than stop A or B, which it seems to have become.
Yeah.
And it's very frustrating because, we know from what we do, oftentimes we can prevent a person from having to have surgery. And same thing. You can oftentimes help a person to be able to prevent or even put off surgery. So surgery is not necessarily the greatest option because sometimes surgical outcomes are not the greatest.
Yeah. Yeah. And that's the sad part, right? Is for some reason we have in our heads that, oh, well, let's go to surgery and get this fixed, right? It's
Yes.
fixed. Once your anatomy is manipulated by surgical intervention,
Mhm,
it's never the same. All
mhm.
right. It's been manipulated. So sure, you can think about it as being fixed, but it's changed. All right. And then you've got to find a healthcare provider to teach your body how to move and how to live with that change in your anatomy. Now, don't get me wrong, there's definitely a time and a place for surgery, and I refer patients to orthopedic surgeons a fair bit, right? When it's like, hey, this is our option.
Mhm.
But I think most of us would agree with you, Cheryl, is let's try the conservative measures first before we go under the knife.
Absolutely. Yeah. I mean, with back surgeries, it's a 50% outcome with surgery. 50% get better and 50% don't get better or get worse. And with
Yeah.
each added surgery, the statistics decline actually. And so we
Yep.
really want to try everything we can, PT included, chiropractic, like whatever we can do to really help prevent that person from having to have
Especially
surgery.
in one of your bigger populations with the chronic back problems, right? I mean, oh man, some of those surgeries are a little bit rough as far as outcomes, and so you're absolutely right. I couldn't agree with you more.
Yeah. So tell us how a person can get in touch with you if they want to ask you some questions or maybe schedule an appointment.
Yeah, so I enjoy those initial conversations with people because I get to know them a little bit. I get to listen to them on the phone or a Zoom meeting, whatever it is, about what they've been dealing with. And to be honest, usually by the time they get to me, they have failed some other treatments, either traditional physical therapy or maybe they've had injections or something like that. And it's just not going the way that they want it to go. So they're looking for somebody to save the day, right? They're kind of in a tough situation. They're trying to avoid those surgeries and they need help. And so getting to listen to the person on the phone, you can uh hear what they're feeling almost through their voice. And that gives me a good idea of if this patient's going to be a good candidate for us or not, right? And so I just recommended people call us. That's the best way. Just call us. I promise if we don't answer the phone, we'll call you right back. Our phone number is 602-837-1244. You can also find us on our webpage. You can sign up for an initial assessment right there on our website. But again, I always recommend, check out our website, sure, but then give us a call. Let me talk to you first, tell you a little bit more about what we do and what we can do for your individual impairment. And then if appropriate, we can set up that initial assessment right over the phone.
Awesome. And what's your website?
Yeah, so it is wall to wall sportsrehab.com. So we use the number two. We don't spell it out. So wall to wall sportsrehab.com.
Awesome. Well, thank you so much for your time today. We are all about educating people about more natural ways that they can take better care of themselves. And I just so appreciate meeting you. And I'm super excited to share your information with our patients because, again, we're all in it to help people. And I love your model is amazing and it fills so many great needs. And I just so look forward to working with you.
I really appreciate that. I appreciate what you all are doing at Trinity Chiropractic as well. And I appreciate the invitation to this conversation. I think, I think you and I are passionate about some of the same things, and I think we're making some changes in the traditional healthcare system, and I'm excited about helping people of the Valley.
Awesome. Well, thanks so much and have a great rest of your day.
You too. Thanks, Cheryl. Bye bye.
Bye.